without further ado, I'll hand it over to you, Dr. Catherine, and let us begin.
Thank you so much, Amaka. And again, thank you so much to Khan for inviting me to be part of this health hour. So I have some slides that I'll share and I'll talk through those. But as Amaka mentioned, I'm really happy to take any comments, questions, reflections afterwards for things that might need further detail or information. So I'm going to share to the screen. Just bear with me whilst I do that. Yeah. And has it happened yet? There we go. And I'll put that into slide format. Great. So hopefully you're seeing these slides up on your screen. So as Amaka mentioned, I'm going to be talking today about smoking and alcohol use. With smoking, I'll largely be talking about tobacco smoking via cigarettes, although I will touch on some other forms of tobacco use as well. And as Amaka mentioned, I'm a director of public health based in Lewisham in London. I do have a medical background before coming into public health, although I just to give a bit of a disclaimer, I haven't seen patients for many, many years, though of course I have some medical knowledge and public health specialist knowledge as well. So in terms of the outline of what I'm going to talk about this morning, as I mentioned, I'll talk about tobacco, cigarette smoking, and I'll touch on vaping as well. That's very topical. I'm sure you've heard a lot about that in news and other by other avenues as well. Then I'm going to talk about alcohol use, just some factual information about that and where you can go for support if you think you may have some challenges around alcohol use or you know somebody that does. And then there'll be some times for questions and answers afterwards. So starting off talking about tobacco. So in the UK, you'll be aware that the main or the most common use of tobacco is via smoking cigarettes. And so tobacco is the component of cigarettes that we are most concerned about, because when you light tobacco and it burns, the smoke contains a whole host of chemicals, thousands of them, in fact. And I've listed here some of the ones that we will typically hear about. So the first listed is nicotine. Now, nicotine is the addictive substance in cigarettes, but in terms of health impact or negative health impact, it's actually relatively harmless, and we use nicotine replacement therapy as one of the things to help people stop smoking. So those are things that will make you addicted to tobacco via cigarettes or other forms of tobacco use in its pure form without any of the other nasties within cigarettes. It can be a helpful aid to stop smoking. In terms of the things that we are concerned about, it is largely things like carbon monoxide, tar, and a whole host of other toxic chemicals that are within tobacco smoke. And maybe just talking a bit about carbon monoxide and tar. So carbon monoxide, it's a gas, and when you inhale that, it can take the place of oxygen in our blood. So hopefully you'll be aware that oxygen is the main chemical in the air that we breathe in. It goes around goes in our bloodstream and helps all of our tissues and cells in our bodies function essentially. And so if you have this other gas displacing or taking the place of oxygen, you can imagine some of the negative impacts there. And then in terms of tar is a sort of sticky brown substance. And if you have seen somebody who's smoked a lot of tobacco, lots of cigarettes, you may notice that they may have staining on their teeth, and that's from the tar. They may also have yellowing of their fingers, etc., or yellowy brownie of the sort of for us the white part of our skin and well, the lighter part of the skin, and you'll see that that is a result of tar within the cigarettes as well. And tar in particular contains cancer-causing particles. Some of you, I'll try to avoid using too much technical language, but Um, we would call them carcinogens, so things that are cancer causing, and that is within tar, which is within the tobacco smoke. So again, you can see some of the potential harmful impacts there. So that's tobacco smoke. I will be focusing largely on cigarette smoking during this particular talk. However, at the bottom of this slide, you'll see that I've mentioned some other forms of tobacco other than cigarettes that some communities do also use, that can also cause health problems. So you'll be aware of shisha pipes, which can contain tobacco, leading to tobacco smoke, which can have some harmful health impacts. There are also things that are smokeless, so things called smokeless tobacco products. You can see some listed there. And these are things that can be chewed, placed in the mouth, inhaled, etc., which can also have some harmful health impacts. However, so I wanted to touch on those just for your awareness, but I'll be talking mostly about cigarette smoking. So that's a bit of an introduction to tobacco use. So how, as I've alluded to a bit already by talking about some of the chemicals within cigarettes, how does that impact on our health in terms of cigarette smoking? So you'll see on this slide, this is a really helpful infographic from an organisation called Public Health England, no longer in place, but they produced a really excellent briefing around tobacco, cigarette smoke, etc., and the health impacts. And so on this infographic or picture here, you can see that, the range of bodily functions or organs that are impacted by smoking. So from top to toe, basically. So if you look, you can see the brain, it increases the risk of you having a stroke by at least 50%. If we move to the sort of head and neck, mouth and throat, it can increase the risk of cancer. Down to the stomach, increase your risk of getting stomach cancer or ulcers. If we think about the heart and lungs, which we typically associate with smoking, in terms of heart health, you can double your risk of having a heart attack. In terms of the lungs, smoking causes the vast majority, 84% of deaths from lung cancer and 83% of deaths from an illness that we call COPD for short. So there's a bit of technical language here, but chronic obstructive pulmonary disease, that stands for, which is a type of chronic lung condition that can cause significant difficulties with breathing over time and unfortunate deaths. And so you can see smoking has, a huge link and connection with that illness in the lungs. In terms of our circulation and blood vessels, you can see that smoking is associated with increase in blood pressure and heart rate. In terms of fertility for both men and women, it can make it harder to conceive children for women, and also cause impotence in men. And then bones and skin, smoking can cause bones to become more brittle or weaker. In terms of skin, it can cause earlier than expected, so premature aging of your skin, between 10 to 20 years. So you can see the whole range of harmful impacts of smoking there. And, why smoking is of concern to public health professionals and most other health professionals is because it's the biggest cause of preventable illness and earlier than expected, so premature death in the country. So because it has such wide-ranging health impacts and can cause people to die earlier than expected, we work both with individuals who are smoking, addicted to cigarettes, to help provide support to quit. But you'll hear in the news a lot about some of the wider environmental things that government, health officials are trying to do to create an environment that makes it easier for people to not only quit smoking, but not take it up in the first place. So a whole range of laws and legislation was proposed by the last government to try and make the environment such that people don't take up smoking and can also find it easier to stop smoking as well. The final point I'll mention around smoking impacts on health, that over time, the rates of smoking have been going down across the country over time. But as it's got less and less common for people to smoke, smoking has become more concentrated in amongst communities or groups that are more disadvantaged. So, for example, in terms of the occupational backgrounds of smokers, about 1 in 4 to 25% of people in what we call routine and manual occupations are smokers, in compared to only 10% of people who are in more managerial or professional occupations. So you can see already some degree of inequality in where smoking is or who is continuing to smoke at the moment. Also, for those who are unemployed, they are twice as likely to smoke as those in work. So again, you can see some of that inequality there in smoking patterns. And then for those who have serious mental illness, the rates of smoking are about 2.5 times that of the sort of average in the whole population. So as though we are quite pleased that smoking rates are coming down, we are there is still a concern about the inequality and where smoking for groups and communities who are more disadvantaged, who are continuing to smoke. So our efforts are still ongoing to help people and support people to stop smoking. So if I move on then to, and also another slide I've included here is around smoking in pregnancy, because there are specific impacts around smoking in pregnancy that I thought would be really important to highlight alongside those other risks that I mentioned earlier. So again, a lot of our efforts around supporting individuals to stop smoking focuses on smoking in pregnancy because of some of the health impacts you can see on this infographic here. So smoking during pregnancy, you can see, causes premature births, miscarriages, and unfortunate deaths around the perinatal or birth period every year in the UK, and also increases the risk of some complications, which you can see here. So, for example, premature births at early birth, children being, babies being born at lower weights at birth, them having problems with their ear, nose, throat, lungs, weight, and diabetes later on in life. So again, we try to do as much as possible to create an environment and support people who are smoking during pregnancy. And I wanted to also highlight the specific importance for Black communities, so Black African, Black Caribbean communities, because those smoking rates in Black communities are actually comparatively lower than in our white British counterparts. Because of the risks to Black African, Black Caribbean communities of smoking related illness, it is important to highlight that because we have increased risk of certain conditions, smoking further compounds that. So as you can see on this slide, there's a Black African, Black Caribbean ethnicity at greater risk of a number of smoking related illnesses in comparison to those of white British ethnicity. So we know, as I've mentioned, smoke is a risk factor for stroke, and those of Black African, Black Caribbean ethnicity have a higher risk of having stroke than those in of white British ethnicity. Also, in terms of diabetes rates, Black Caribbean women have a higher risk of having diabetes in comparison to the general population. And we know that compared to non-smokers with diabetes, people with diabetes who smoke have a much higher risk of earlier than expected death. So just to point out here that because of some of our other risks of smoking related illness, is that much more important for us to think about how we can support communities, support individuals who are smoking, to help them find ways to stop. Okay, so what happens when you stop smoking? So I've got a lot of infographics here. I took this infographic from another excellent website called the Better Health website, provided by the NHS. Again, I've included all of these links here. So hopefully if these slides are circulated, you'll be able to click in and click through and read more information. But the impacts of when you stop smoking. So we've seen all those negative health impacts, but there are sort of immediate converse impacts when you stop smoking and when you quit. So on this slide, you'll see it says the sooner you quit, the sooner you'll notice positive health impacts for your body. Let's see what happens through your journey of quitting smoking. So as soon as 20 minutes, I mean, it sounds, like really, can that happen after 20 minutes? But it's definitely evidence-based that after 20 minutes, if you check your pulse rate, once you've stopped smoking, you already notice that it starts to go down. Then after 2 days, the carbon monoxide, which is that gas that I mentioned that can displace oxygen in your bloodstream, after 2 days, that starts to be flushed out once you've stopped smoking. And your lungs will also start to clear out some of the mucus, some of your sense of taste and smell will also start to improve. So that's after 2 days of stopping smoking. Then if we move into the weeks, so between 2 and 12 weeks, you'll see that your circulation and how your blood is moving around the body will start to have improved. So I've gone down rather than across. I'll go back to the 8 hours. After 8 hours, your oxygen levels will start recovering. And as I mentioned, the carbon monoxide levels will reduce. After 72 hours, 3 days, your breathing will start to feel different and easier and better after you stop smoking. And then that 3 to 9 month period, if you did have any respiratory or lung symptoms, for example, coughing, wheezing, breathing problems, they will start to improve. And then we get into the longer term. So if you stop smoking after a year, excellent, fantastic. Your risk of heart attack will have halved in comparison to of those who continue to smoke. And then the longer term, extremely long term benefits after 10 years of stopping smoking, your risk of death, so that risk of earlier death, risk of lung cancer will have halved in comparison to those who continue to smoke. So you can see that there are benefits of smoking, no matter how long you have smoked for, or anybody that you've known, no matter how long they've smoked for, if they stop, very immediate and long-term positive benefits of quitting smoking. So if you are a smoker or you know somebody who's smoking, what support can they have to stop smoking? So again, another infographic that I've taken from that Public Health England website, you can see here, I hope it's projecting well, the different evidence-based options for quitting smoking. So I'll actually go backwards. I'll start from what you can see as number 4, and then I'll go up to number 1. So if you're a smoker, you know somebody who smokes, and they decide they want to stop smoking, if they decide to stop smoking and they just want to go it alone, they want to use their own willpower to do that, that's positive because they've taken that step forward and they want to stop smoking. But using their willpower alone, in comparison to some other interventions that we have, is probably the least effective method. It may be likely that they start smoking again if tempted or in particular environments. So it's great if somebody wants to stop smoking, but we would advise that they choose one of these other interventions on steps 1 to 3 to help their success with them being successful in quitting smoking. So the next step up, number 3, there are a number of what we call over-the-counter options for quitting smoking. So if you remember, I mentioned nicotine being the addictive substance within cigarettes. If we take out all of the other nasty stuff, tar, etc., that are in tobacco smoke, and you just have nicotine on its own, you can provide that nicotine via a patch, gum, via e-cigarettes or vapes, which I'm going to talk a bit more about shortly, to help wean the person off cigarettes. We can provide that nicotine replacement in various levels of doses to help someone eventually stop smoking. So if somebody decides they want to give up smoking, they want to use their willpower, but they also want to add on using some of these over-the-counter replacement therapies, the chance of being successful increases much more than you doing it just with willpower alone. And then if we move up to number 2, If you also then think about using some medications which can be prescribed by your GP, your pharmacist, or another health professional, that further doubles a person's chances of success of quitting. And then the most effective, that being number one, is if you seek support from a local stop smoking service. So most local areas should have a free stop smoking service. Certainly in my borough, Lewisham, we have those for those who smoke and want support with quitting. And that offers your best chance of success, because alongside having options to have the medications that are prescribed and the over-counter nicotine replacement, you also get what we call behavioural support. So you get support from a trained stop smoking specialist to support you over a number of weeks to help you stop smoking. So that is the most effective holistic model to support people from quitting smoking. So as I mentioned, most local areas have that, and it's much easier to stop smoking if you get that sort of rounded holistic support with professional help. You're 3 times more likely to quit for good. You can, with this link here via the NHS website, you can search your postcode or local area to find a local service if you or somebody you know wants to find that local support. As I mentioned, the services are usually free, and there's expert advice and encouragement and support. The advisors within those services are trained, so they can support you on a one-to-one basis or via group sessions. And some will also provide the medications that I've mentioned. There may be some prescription charges in some areas. You'll be able to access that without a charge. And sessions will be held for a number of weeks, typically once a week for a period of 4 weeks after you've had your last cigarette, to help to provide that support over that period of time to help you stop smoking. And there's really good evidence that people who are able to stop smoking for 28 days are more likely to stop for good. So that's just a bit about support to quit smoking. And then on the tobacco section, I think the final thing I'll mention on this side, because I know maybe I'm running out of time and we're going to touch on alcohol as well, is vaping. So you would have heard a lot about this, as I mentioned, in the news, etc. And so I thought just helpful to mention a few key points about this. So for those who are not aware, vapes are these electronic devices that enable you to inhale nicotine as an aerosol or vapor instead of smoking a cigarette. And so similarly to the patches or gum, it's helping you have the nicotine on its own, that addictive substance, to help you taper off, to help you eventually stop smoking. So nicotine vaping by these electronic devices is much, much, much less harmful than smoking cigarettes. And it's also an effective tool for you to help stop smoking. However, it's not completely harmless or risk-free. So public health professionals, we recommend that vapes are only used by adult smokers in their attempt to quit smoking and to stay quit. So we would only advise it or recommend vaping in that circumstance. For those who have never smoked, and for young people under the age of 18, they should not take up vaping. Of course, the healthiest option overall is to not smoke or vape at all. But if you want support to stop smoking, then we would say, okay, you can use a vape to help taper down your nicotine intake and to stop smoking eventually. So anybody who does take up vaping, we would advise that you should aim eventually to stop vaping as well. And that will be the healthiest option overall. So I just wanted to add those key messages around vaping there. So that's the section about tobacco, cigarette smoking. I'm now going to move on. I have some slides around alcohol use. So it's a lot of information. I hope you're able to digest it all, but again, we'll have some time for questions and answers afterwards. So alcohol and impacts on health. So again, I've taken another infographic. Apologies, I haven't included the source here, so I'll make sure that I do that before the slides are circulated. But alcohol. So Alcohol, I'll come on to some of the guidelines around levels of alcohol intake, etc. But again, can damage, can be harmful to health. And again, you can see in this infographic from head almost to toe, there are so many harmful impacts of alcohol use. So again, if we look at from the brain, stroke, so that brain cardiovascular disease there. If we're looking at mental health in terms of depression and anxiety, alcohol use can be linked to that. Moving down, again, cancer of the mouth, throat, your food pipe can be associated with alcohol or high levels of alcohol use. Can also be linked with challenges with heart disease, blood pressure in women, risk of breast cancer, affecting liver and pancreas. So one of the glands, if you like, or organs close by the liver, the pancreas, can become inflamed with high levels of alcohol use. Liver in particular, you can develop something called liver cirrhosis, a chronic illness of the liver, or indeed liver cancer with high levels of alcohol use. Fertility, again, some challenges with fertility with high levels of alcohol use, and then drinking during pregnancy in very high levels can also lead to some harm to growing babies as well. So that's just an overview of some of the health impacts associated with high levels of alcohol use. So in terms of the guidelines, what do they say about levels of use? So again, I've taken an infographic. This is from the Better Health website from the NHS, just to give some examples around units, because typically the guidelines talk about units of alcohol. We as individuals rarely talk about units. We talk about glasses or bottles or cans. So I put this up here just to help with that, with translating what a unit means. So in terms of the guidelines, it's recommended to drink no more than 14 units of alcohol a week, and that should be spread ideally across 3 days or more. And so if we think about what a unit is, if we look at the infographic here, so 1 unit of alcohol is equivalent to half a pint of regular beer, lager, or cider, half a small glass of wine, 1 single measure of spirits, 1 small glass of sherry if you're a sherry drinker, or 1 single measure of an aperitif. So that's what 1 unit looks like. And so you're to have no more than 14 amounts of that per week, spread across 3 days or more. And so you can see the equivalent, it's 6 medium glasses of wine or 6 pints of beer a week, but no more than that. And then you can see at the bottom of the infographic what is more than 1 single unit. So the things that we would talk about, bottles or pints, etc., these are all more than that 1 unit that's talked about in the guidelines. But having said that, so no more than 14 units, but really there's no complete safe or completely safe level of drinking. But staying to these guidelines will risk all those harmful effects that I mentioned in the previous slide around alcohol and health. So it's ideal to keep below this, but as low as possible, is the healthiest option. So what are the benefits? Similar to when I talked about stopping smoking, what are the benefits of drinking less? So keeping well below that 14 units and ideally lower than that. So there's short-term benefits, long-term benefits. In terms of the short term of drinking less, there'll be these impacts of feeling better in your mornings, feeling less tired, having more energy, having better looking skin, and also saving money. Alcohol costs money. And I'll just mention one point about that like smoking, there's lots in our, and sometimes healthy eating, there's lots in our environment that is not conducive to people drinking less, eating healthier, smoking less. And so again, public health professionals, we are concerned about not only supporting individuals to drink less, eat healthier, not smoke, but also making the environment such that people are less able to access some of the things that are not as helpful for their health. Likewise for drinking. So there are obviously, some commercial interest in selling alcohol. And so drinking less, one of those key benefits will be that you spend less money on that and save some money. In terms of longer term benefits on health, so some of those impacts that I mentioned around blood pressure, risk of stroke, cancer, liver disease, all helped in the longer term by drinking less. Cholesterol levels, so cholesterol is linked to heart health and the health of your blood vessels. You will have lower levels there. A better mood, memory, quality of sleep very hugely important for health, and also help with weight management because alcohol does contain calories. So drinking less can support weight management as well. So again, talking about support now. So, what are some of the indicators that you or somebody that you know may need help with the amount that they're drinking? So it may be because somebody often feels the need to have a drink. So they will be drinking potentially early in the morning, times of day when you wouldn't expect them to be drinking because they have that need. They may be getting into trouble because of their drinking. They may be finding that other people are warning them about how much they're drinking. And they may themselves think that their drink is causing them problems in their personal life, in their social life, in their work life. So these are some of the pointers that, okay, I may need to look for some help around my alcohol use here. Looking at those units, I might be way above those guidelines. So where would you go to if you need support? So going to see your GP is a good first place to go for help. Your GP will typically have contacts with local services to help people with their drinking. So you may want to go there. I would advise that, in our communities, both smoking and alcohol use, sometimes people can feel that, I don't want to be too open and honest about, how much I'm drinking, what will people think of me, etc. But I would encourage, and as I've mentioned, both for smoking and for alcohol, in cigarettes, we've heard that nicotine is an addictive substance. So once you start smoking, there are biological responses that make you want to continue smoking. So viewing it as something that you're addicted to, that your body has become used to, similarly to alcohol, for me, there should be no shame in that, because it's your body now that has become accustomed to having these substances, and you simply will just need some support to help you get through that. So I would encourage you that if you do go to see your GP or any other healthcare professional, they will be keeping your information confidential. So, as much as you can, be open and honest about how much you're drinking, the struggles that you're having, and they'll then best be able to identify the type of support that you need. Your GP, they might suggest different types of assessment that are needed, different support options that are available to you based on what they feel your level of need is around alcohol use. So are you somebody that is drinking too much at one time, so maybe on that binge drinking side of things? Are you somebody that's developed a bit of a dependency around drinking where you may need further support? They will be able to determine what type of assessment is needed for that. If you have become physically dependent, i.e. your body needs that drink to feel okay, and you've become physically dependent and need to stop drinking, stopping straight away or overnight could be harmful for you. So again, seek support from your GP if you feel that has happened, or somebody that you know has become physically dependent. They will probably need some longer term tailored support to stop drinking rather than stopping straight away. So get some advice about that and about any medicines that you might need to withdraw or reduce your alcohol intake in a safe way. And I've talked so much now, so I'm just going to end with some useful contacts around support for alcohol use. So there are so many. They're local services. They're these national services that I'm signposting you to, and this is all from the NHS website. So There is a national alcohol helpline if you want to, if you're maybe not too comfortable seeing talking to your GP and you want to talk to somebody via a helpline in complete confidence, there are those available. So there's Drinkline, and there's Alcohol Anonymous, which is a free self-help group. There are family groups. So if it's somebody that you know that you're concerned about their how much alcohol they're drinking, you're not entirely sure what to do, there are family support groups as well. And I won't go through all of them, but there are a range of contacts there. So yeah, I suppose as I end, just a final encouragement that if it's for yourself, it's for somebody you know, um, do reach out for help around smoking. As you can see, there's so much local support available and evidence-based support to help stop smoking. Likewise for alcohol, depending on the level of alcohol use, there are a range of support options available. So if you know somebody, you want to talk to them or signpost them to some of these contacts, or if it's you yourself, please do reach out for help and support. It's available there for you. So I'll stop there. I'll stop sharing my screen, and I hope there is time to take some questions.
Well, thank you so much for that, Dr. Catherine. That was an extremely informative, engaging session. So thank you so much for that. We do have some questions and we have a time for questions now. And if you have any questions, anything that anyone wants explained further, put it in the chat, all of the chats, and we'll try and get through to them. Some really key and interesting facts there, Catherine, because I know smoking and alcohol is something that we're all aware of, but I don't think a lot of people know like the key facts and the dangers with it. And one thing that struck me was one of the facts and the statistics you put about stopping smoking can like halve smoking can double your risk of a heart attack. Like that's quite severe, and a lot of people don't know like the risk involved with that. But let's get into the questions. First question we have for you, Dr. Catherine. What are your views on the former government's plans to ban the sale of cigarettes to people under the age of 14? Do you think this will be effective in reducing this practice?
Thank you for that question. And yes, I was very supportive of those plans because, as I mentioned, with things like smoking, alcohol use that are addictive, once somebody starts smoking at an early age, it can be very difficult to stop smoking, even with the support available. So for me, using legal instruments to help people or to prevent young people from taking up smoking and becoming addicted potentially for many years in their life and the associated health impacts, I was supportive of that 100%. And I think where we have seen legal instruments used, for example, the ban on smoking in indoor spaces, etc., we've seen the societal shift and change that happens with that. So changing the environment can help make it much easier for people to stop smoking, and leading to all those harmful health impacts. Yeah, so I was very supportive.
Okay, thank you so much. I guess it's the case of like prevention is better than cure, because if you try and stop it early, that will reduce costs, reduce the because if you're trying to treat it and reverse, it's much harder to reverse the effects that it's already had. It's much better to prevent that. So
Exactly.
that's really useful. Yeah, thank you. We've got a second question. People sometimes say that there are health benefits to drinking red wine. Is that true? And if so, would it not be healthier to simply not drink at all, given the many harmful factors linked with alcohol? Yeah.
Yeah, I remember being taught something about that. So I think there was some evidence base around very, very mild levels of alcohol use. I'll probably have to get the proper reference around that and red wine and I think heart health, etc. But as I mentioned in my slides, it with alcohol, you just have to be very careful, I would say, about the levels and how you're drinking. And so for me, definitely the guidelines stick, below those weekly number of units that you're meant to be adhering to, and just be cautious about the levels. Just be cautious. about the levels and how much control you have over how much you're drinking, even if it is that one glass of red wine, etc. So yeah, I would go back to making sure you stick to the guidelines, maintaining those relatively mild levels of drinking. Yeah, that's what I would stick to.
Yeah, no, that's really helpful because I know there's all sorts of like rumors and wives' tales, people saying that, but it's important to stick with research and the guidelines that are made for a reason to benefit our health. So yeah, sticking to the guidelines and just being familiar with, oh, this is what's recommended, this is what's not recommended, because there is a reason why these recommendations are in place. So thanks for that. Question number 3. What are the health risks associated when drinking what are the health risks associated with drinking when breastfeeding?
Thank you. That's a really good question that I don't have very good answer to at the moment, or good information in my slides. So it's something that I'll have to follow up with you afterwards, probably in some information from the NHS. But as I mentioned, the main information that I had was around smoking whilst drinking whilst pregnant, and drinking in general. So certainly adhering to those guidelines. With breastfeeding, I would have to look into that and provide some information. So I don't know who asked that question, but I'll try to make sure that I do that and come back to include something in the slides that go out afterwards, if that's okay.
Yeah, that's perfectly fine, no worries. And once you get that information, you could share it with CANS and then they could distribute that widely. Because I am a pharmacist. I work in the neonatal unit actually, in a children's hospital, and there are risks associated with certain drugs when mums are breastfeeding. Smoking, I'm not smoking and alcohol, I'm not too familiar with though, but it'd be useful to have that information. It looks like we have a raised hand. I think B has raised her hand. She might have a question. But we'll get to that. But there are some other questions in the chat. Someone has asked that there's not much emphasis placed on secondhand smoking. How harmful is this? How harmful can it be?
There are significant risks of secondhand smoking, and that's another reason why the smoking in public places legislation was brought in, because it's not just the smoker. So the harms to health that I mentioned in my slides for the individual who's smoking, some of those can also be experienced by people who are secondhand smokers, particularly if you're in the same household as somebody who smoked, in the same family as somebody who smoked, and as much as being in those public spaces with people who smoke as well. So there are harms to health, certainly from secondhand smoking, that was helped significantly by some of that legislation that was brought in.
Okay, great. Thank you for that. We've got a raised hand from B. I think someone's going to unmute her so she's able to ask her question or...
Hello there. Can you hear me?
Yeah, that's fine. We can hear you.
Fantastic. It's great joining this audience today. Thank you very much, Catherine, for the information that you've given so far. Just for a bit of context, so I'm a pharmacist by background as well, and I just was making some notes, and where you mentioned about visiting your GP or speaking to your GP, of course, my antennas went up, and I thought, oh, there are other healthcare providers, and it's really important that we ensure that traffic is not diverted into one direction. But you did say later on about approaching other health providers to ensure that to speak to other people that can help as well. A couple of things I just wanted to highlight is about changes in smoking habits in terms of reducing your smoking or reducing your alcohol intake can affect prescribed medication. So it is really important, just wanted to highlight that, really important that people, once they've taken that decision, that they do need to speak or should be speaking to healthcare providers if they're taking prescribed medicines, that some things might need to be altered because it will change the dose that goes into their body. So that is something that they ought to be aware of as well. The other thing I wanted to mention as well is about, in terms of public health and the effects of improving one part of lifestyle in terms of helping people to stop smoking or reduce alcohol consumption. There are several social socio-economical factors, determinants as well that needs to be addressed. And often enough, there is a shift in balance of focusing on one thing without focusing on the person holistically. And I appreciate there is a lot of funding and other things to take into consideration. And where we're talking about health inequalities, often enough, of course, people that fall into that often have several problems, mental illness, financial worries, and all sorts of problems as well. That perhaps in terms of how the government, and I'm not expecting anyone to solve this problem at this point in time, but just highlighting that in terms of the government focusing on one thing and not focusing on the whole problem to ensure that we're not taking care of one thing without looking at the other things. And I just wondered, in terms of your input or what is imminently coming forward, what kind of things are being done in that space to ensure that, public health is not just about the smoking and the alcohol, of course, it's also about a whole other set of factors that needs to be addressed in tandem, in effect, to ensure that we truly conquer the problems, the societal problems that is ongoing. And the last thing I just wanted to say is the environmental impact of smoking as well, in terms of pollution and affecting other healthcare problems like asthma. So it's not just what it creates, it's a problem that is already in place and how it can affect other people that are exposed to smoking, and just highlighting that. Thank you very much.
Thank you so much, Bea. Those are excellent points, so fantastic. And the one that I'll pick up on is what you mentioned around the holistic nature of things, when we pick out one thing, so for example, eat healthier or drink less or don't smoke, are we missing something about the bigger, which is all public health, the bigger picture? And so one of the concepts that has been quite prominent over a number of years now in public health is something that some of you might have heard. I don't want to get too technical, but it's called about the wider determinants of health or social determinants of health, which you could think about as being building blocks of health. So what are the things that actually make us healthy as individuals in society? And how can we as public health people, but government, local government, etc., all start working towards those? So the things that keep us healthy are things like having a good job and good quality work, having enough money in your pocket, having a good house to live in, having a safe environment, having good friends and community. Those are all the very key building blocks or social determinants of health. And so I think there are these lifestyle, I suppose we can call them health behaviours, like smoking, etc. But they are, and they're risk factors for illness, but underneath that are all the things about the communities and environments within which we live. And so there has definitely been a marked shift in public health focus to look at those building blocks of health. So, for example, in Lewisham, we're developing a strategy at the moment around health and wellbeing, where we will be looking at housing and health. We will be looking at poverty and health and the cost of living. We'll be looking at education and health, because without those building blocks being good, and the best they can be, it's going to be very difficult to tackle some of the health behaviours like smoking, and as I've mentioned, in the slides, that now we can see smoking is declining, but certain groups of people, those who are unemployed, those who have serious mental illness, continue to have higher rates of smoking than others. So we have to start looking at some of those building blocks. And so I agree with you 100% that I can assure you that there is that shift in focus, but I think it is bringing the whole of, public health definition, the organised efforts of all of society to look at those building blocks to make sure that the environments and places and spaces where people live are as good as possible to help prevent them taking up any negative health behaviours over time. Thank you.
No, thank you so much, Catherine, and also Bea. That was really, really useful information and input you put in there. You're so right, Catherine, about just like the holistic factor of health and the building blocks that make health essentially, because it's all good and well saying, oh, people should eat healthier, exercise more, stop doing this, stop doing that. But if someone isn't getting enough money, if they don't have a warm home to go back to, if they can't afford certain types of food, because healthier foods sometimes just tend to be more expensive. Sometimes you've got the quick fast food ready-made option that isn't always the healthiest. But it is very, very important to tackle those foundations first. And it's great to hear of councils doing this and noticing this so that you can tackle it at the root before it gets bad. So educating people, provide them with housing and healthcare. And I feel like once you start doing that, you'll definitely start to see some results in people's health improving, mental health being a big factor as well in for smoking, alcohol. Because if people aren't coping with their lifestyle, if they don't have a job, if they can't afford housing, they may turn to alcohol or smoking, which can help their mental health deteriorate. So it's all these factors that can contribute to bad health, but helping someone at the root, such as their housing and education and things like that, will definitely make a difference. So it's really encouraging to hear councils noticing that and actually doing that. So thank you for that. We've got another question in the chat that says, is it possible to develop an intolerance or even an allergy to alcohol? In the case of intolerance, can this develop as a result of not drinking at all for a prolonged period, being teetotal? So I think the question is asking, is it possible to develop an intolerance after maybe not drinking for a long period of time, if you understand what I'm saying?
Yeah, no, I do. Thank you for the question. Now, I think that is definitely outside of my area of expertise, I have to say. I don't know about intolerances to alcohol, if I'm being totally honest. So again, potentially I may need to look for some clinical advice around allergies, intolerances, if you've had some time away from alcohol, etc. So again, if that's something alongside the question about breastfeeding, I could come back to and include in the slide pack that's circulated afterwards. I'll try and do that for you.
Okay, no worries at all. That's really helpful. And I think Bea mentioned this earlier as well, but she's a pharmacist and me too. I'm also a pharmacist. I work in community sometimes. So I know there's a lot of strain on GPs and healthcare professionals, but there are other professionals, such as pharmacists, that are much more accessible in your community, have multiple pharmacies in multiple different areas. If you just go in, majority of them should have a pharmacist there that is capable of counselling and helping with smoking cessation guidance and advice, and that's much more direct and easily accessible. And just having that support in the community can be really helpful, because I don't know if you see this, Catherine, but is it just that first step of making up your mind, like, okay, I'm gonna do it, I'm gonna quit? That could essentially just be the hardest part. And then with the support that you get, the slide that you had of the difference quitting smoking makes in a couple of months, a couple of years, that was amazing. Like, it's such a profound difference, and it all starts with yes, I'm committed to bettering my health and my lifestyle. So just taking that first step, would you say that's the hardest part and it gets easier?
Exactly. I think, that decision to do it again, especially with things that are addictive, because it's almost like you have to override what your body has become used to with, that having that nicotine, etc. So it takes huge amounts of willpower, first of all, just to say, okay, though my body is craving this, I'm going to say, because I know for whatever reason I want to not do this anymore. That's huge. And I think, having good support services, systems are so critical for that person making that step, for us just to pick them up and be like, right, okay, good, we're going to support you all the way through. So having those local services, critical to support people.
Brilliant. And I think in one of the slides you mentioned if you've got like a family or a friend that is affected by either alcohol or something, do you have any sources or resources or where to signpost them saying, okay, I can't deal with them by myself, I need like professional help? If, say, someone in your life or your family was really struggling with alcohol, what would you recommend be the first step in getting that help for that person, assuming that the person is willing to get help?
Exactly. So a number of the links in the final slide around alcohol certainly are a great source of support. So you could either talk to that individual and provide the links. You could depending again on the nature of the relationship with the person, you could even try and accompany them to something, to give them some moral support if they're attending a support group, or even they're going to the GP or other healthcare professionals. So there are so many avenues for support listed there, and it may take you supporting that individual. Of course, it has to be their choice, and they have to want to do that. But if they do say they want to do that and need a bit of moral support just to get them to a particular venue or to a particular healthcare setting, by all means take them there. But all of those links, again with the slides, they'll be circulated and they're all available. I mean, we have some really good NHS website, by the way, with all of this information, so I will provide the links. But again, if you even search nhs.uk alcohol support, a lot of these avenues of information will be provided for you.
Okay, thank you so much. I give the shout out to NHS website, because I think that is very underappreciated. The website, the wealth of information that is on there is incredible, and it's so accessible. The way that they explain conditions and recommendations and signposts on there is really simple, and anyone can use it. So if anyone wants further information on any kind of conditions, NHS website, that's a great source. And also the slides will if you're only joining now or you've missed parts of the presentation, don't worry, it will be on YouTube for you guys to listen back and really take in all that knowledge. I've got another question actually, Catherine. I know you touched on vaping, but I wanted to speak about shisha as well. It's something that can be quite cultural in some cultures, and I wanted to ask about the harmful effects of this, or is this, like, would you compare this to smoking? Is it better or is it worse, or do you have any information about that?
Yeah, I have a bit of information that I got from a website called Action for Smoking and Health, ASH, and they talked about shisha if it contains tobacco. So as I mentioned, those harmful components of tobacco, if it contains tobacco and that tobacco is burnt up in any way, you would get the tobacco smoke inhaled alongside. I believe there's flavors and etc. within shisha. So if it does have that tobacco smoke component, you still will have those harmful chemicals being inhaled, and then you will have health impacts. So I think if you've got tobacco, I know there's also herbal shisha. Even if they don't contain tobacco, some of that burning up of the herbal substances can also have some health impacts. So I think it's important, if you are inhaling shisha, just to check, are there tobacco components? What are the components that are being burnt up here? And then you'll be able to identify the health impacts. But I can also, there's a lot I'm going to include in the slides, but I can also include a bit more on shisha, because there is a really excellent fact. It's quite detailed, but I can just pick out some key points around shisha use as well.
Okay, thank you so much for that. And I know earlier on you mentioned about pairing actions with legislation and how you can see the effect of that. I think it was 2007 the legislation came in when they banned people from smoking indoors. I think there's some talk in the news recently about the government considering banning smoking in outdoor venues as well, such as pub gardens. What are your views on that at all?
So I think it's an extension of that previous legislation. I would say the question about secondhand smoking is important to think about here. So even though you have ventilation, etc., with outdoor spaces, you could still, depending on the proximity that you are to an individual, be picking up on secondhand smoke. So there's that risk that could be mitigated by such legislation. But there's also the wider, as I mentioned, environmental piece about the environments that we have, making them less, what can I say, amenable to people smoking can also be something that encourages people to stop. So I think there's multiple levels within which that legislation may, or any changes in that space could impact. And the final thing I'll say about that, not necessarily maybe pub gardens, but maybe playgrounds, etc., where there's children, where they don't have a choice necessarily about somebody smoking or not, and then picking up on secondhand smoke. There are also those benefits to extending legislation to other potentially outdoor spaces where there might be harmful impacts of secondhand smoke.
Okay, thank you so much for that, Catherine. We're beginning to round up now, and I just want to say a massive thank you for everyone that has tuned in from all the different platforms from all over the world, and a big thank you to Dr. Catherine. I feel like these sessions are really, really important for the community, and it's important that we educate ourselves on topics like this that are quite prevalent and very important, so that we can disperse this knowledge with our wider communities and our wider environment. So thank you so much, Catherine, for taking your time this beautiful Sunday morning. I don't know what it's like in London, but it's beautiful here in Manchester. I can't wait to get outside. Thank you all so much for joining, and I hope you have a lovely day. I think I'm going to be passing it on to Wisdom now from Cannes, who's just going to round it all up. So thank you so much. This will be uploaded on YouTube if you're only catching the end of it now. So don't worry, the information will all be available. Thank you so much.
Good morning, everyone. Thank you so much, Amaka and Dr. Mbema, for all the insightful information. Ruth, can you please share the slides for today?
Wisdom is for you to share from your side, please. Thank you.
Yeah, that's fine. So, second for that.
I think Wisdom's just having a few issues with his tech. If you could just stay with us for a few more minutes as we tell you what's going on in the next few weeks. Thank you.
Apologies about that. The same time next week, we'll be having Dr. Ibis Erikisima on a topic chronic kidney diseases, and that'll be at the same time, 7 September next week. Next slide, please. And also the power of hydration, that's next week, Tuesday, 3rd September, from 6:30 p.m. to 8:30 p.m. And our guest speaker will be Sylvia Ofobi, Dr. Hiba Osekwesi, and Orlando Grant. So see you next week, and you can scan the QR code to sign up. Thank you. Send next slide, please. So we'll be going next month is the Black History Month, and we'll be celebrating it in Manchester, the Manchester Cathedral on the 25th of September, from 6:30 p.m. to 9 o'clock. So you could sign up to join us on that day. Next slide, please. Be a part of the Greater Manchester Events Directory. So any information, you can send it to bhm@can.org.uk. Next slide. Thank you so much, and see you same time next week. Thank you so much, and enjoy the rest of the weekend. Bye.